This segment is sponsored by GBMC Healthcare.
Well, the COVID-19 pandemic can feel like a never-ending race for several frontline healthcare workers, making them vulnerable for mental burnout. So while many of us can stay home or work from home, our nurses, doctors, and other workers on the front lines do not have that luxury. So joining us to talk today about mental health for frontline workers is Dr. Anthony Chico, Director of Emergency Psychiatry at GBMC. Thank you so much for joining us.
Hi, thank you for having me.
All right, so there's been a whole lot of news coverage recently on the worsening of frontline workers' mental health. What are some of the signs that family and maybe even colleagues should look for?
Well, the sign for healthcare providers is no different than the sign for any of us going through this pandemic. During this time, we are seeing all of us struggling at times with sleep patterns, eating patterns. If we see one of our colleagues socially isolating more, and generally just giving a sense of hopelessness, that certainly is a sign that we should reach out to our colleagues and try to assist them and help them in any way.
Okay, so what are some of the factors that are contributing to the psychological distress of healthcare workers who are providing that direct frontline care to patients during the pandemic?
I would say the biggest factor really is just the uncertainty, especially around the timeline. Myself and many of my colleagues now have been battling this for a good 7 to 8 months, and there's questions. Are we halfway through this? Are we almost through this? Certainly yesterday's news from Pfizer was a wonderful sign of encouragement, but we're still in the battle. Along with that, there's a concern that there might be a surge, what we see coming from Europe. Certainly we're in the middle of influenza as well. So just the preparation that things may get worse before they get better is very concerning to all of us that work in healthcare.
So is there anywhere that healthcare workers can turn to for support to help them manage their own mental health?
Well, there's many sources of support, both locally and nationally. First of all, I would say to any colleague that we have to take care of ourselves. We have to be a good example for our patients, making sure that we have a good basic routine with our sleep and our eating, trying to stay connected. It's important to stay physically distant, but not socially distant from each other. In terms of local support, I would ask anyone to check with your local hospital that you work at to see if there's something within the hospital. Here in Maryland, MedChi, which is a physician group, does have services for physicians who might be struggling. And then nationally, there are hotlines for physicians, as well as a wonderful resource you could check through Massachusetts General Hospital. They have a great resource for healthcare providers. They have videos, good guidelines to follow.
All right. Well, Dr. Anthony Chico, such great advice. Thank you so much for your time today.
Thank you.